Doctors of Reddit. What is something that you wish everyone knew about their body? Ejaculating blood happens to most people at least once in their lives, and in 99% of cases it resolves without taking any action within a week. It doesn't even warrant a doctor visit. Peeing blood, for both sexes, is a serious medical emergency and you should immediately go to the ER. People think it's the other way around. If you could keep track of the assorted parts you've had removed or added, that'd be very helpful. I'm not saying you need to know whether your fundoplication was a Nissan or a door, but if you're complaining about belly pain, it would be nice to know that the last time you had belly pain they took out your gallbladder, appendix, sigmoid colon. And if you've ever had something implanted, and they gave you a little card, that's not warranty information. That tells us if you're going to explode if you go in an MRI. Bring it. Otherwise it will be Googled. Don't do DIY surgery or hold off on reporting things that are obvious warning signs. Don't be the guy who tried to remove his skin cancer with a knife. That there is a wide range of normal. Don't be embarrassed by your body. Having said that, if you are concerned about anything, ask your doctor. We have generally heard it all before, and trust me, we have, nearly always, seen it all before. Maybe you have something that has been bothering you for ages, but you were too scared or embarrassed to ask about it. Just ask. It might be nothing and you have been stressing about it for no reason. And if not, then you are at least one step closer to getting it fixed. No one can help if they don't know. There are no stupid questions, so ask away. I'm always amazed when I have been asked about something that has been bothering a patient for years and years, but they were too embarrassed, scared to bring it up. Most of the time, it is nothing, a completely normal body function feature. Other times, it is something that should have been discussed right away. You know your body best, so speak up. Don't wait for the doctor to ask the right question. You need some kind of exercise. Doesn't matter how you feel right now. Sitting for 12-16 hours a day will have negative consequences. Type 2 diabetes is more serious than most people realize. I work as a doctor in hemodialysis and most of them are due to diabetic nephropathy. It also affects your eyes, nerves, immune system, etc. Simple life changes can help you, but Noon seems to care. I even lost 9 kilograms myself because I had a family history of diabetes and to be healthy. Edit. Wow, thanks for the silver stranger. I didn't expect this comment to be big, but please take care of yourselves people, because it is really sad for us doctors to see people get ill because of a preventable illness. Also, there are lots of good subreddits for people trying to make a lifestyle change. You and your body deserve better. Edit 2. Changed diabetes to type 2 diabetes for clarification. Changed easy to simple. This is going to sound really basic, but I wish my patients would know what meds they are on when they come to the hospital. At least once a day comes somebody in who goes, yeah, I take 8 pills in the morning, 3 in the evening, and 4 at lunch, but don't ask me which. You're a doctor. You should know. I beg of you, before going to a doctor that has never seen you before, write your meds, dosis and all on a piece of paper. That administering CPR compressions ASAP is one of the greatest indicators of successful outcomes. Baby doctor here, about to graduate. Unless you have liver or kidney failure, your body detoxes itself really well. Don't get scammed by these detox teas and whatever. Edit. I mean that I'm a baby cause I'm just starting out. Not that I'm a doctor of babies. Just to be clear, I won't specialize for a while yet. Your mental health is just as important as your physical health. That they only have one and their behavior now. Drinking, smoking, not taking medicines, or whatever will impact their life quality and expectancy. Sounds logical, but very few patients really realize it. In males, there is a vestigial remnant of the uterus located in the prostate. It's called the prostatic utricle. It is a duct that leads nowhere. It sometimes has some remote endometrium in it and can produce 1 drop of blood every 28 days. Source: embryology professor in med school. So yeah, guys can get PMS too, but it's probably better to call it BMS, or premenstrual syndrome. I'm not a doctor, but as someone that works with those who may be in a psychotic break, get sleep. Most psychosis happens because someone haven't had slept or haven't had good sleep for extended periods of time. Some people just need 20 straight hours of sleep and then they never end up in a psychiatric hospital ever again. And don't just randomly stop your medication because you feel better. You feel better because you have consistent amount of whatever is leveled in your body now. And now that your body is hitting equilibrium, everything is going great. So keep doing what you're doing. I've seen people go on and off their medications for years, and it really starts to mess up your body if you do that for too long. Holy shit. This needs to be a SAR. Kids, stop getting those magnet piercings on your mouth. Every week a dozen idiots come in swallowing them. Once in a blue moon we have to take them to theater, open them up and fish them out. The issue is if they don't come out by you shitting them, there's a risk they make a hole in your bowel, fistula, and it becomes an emergency. That's why we'd rather fish them out before we have to cut out bits of your bow. Teeth are the most disrespected body part. A healthy set is as important as a healthy heart. Infective endocarditis is a thing too. Edit. My patients also don't seem to realize that healthy and clean teeth makes you look much younger than you actually are. Absolutely avalanched here, but your brain is an organ like any other, susceptible to disease and malfunction. When shit is going awry mentally, it is in absolutely no way different to lungs struggling with bronchitis. Your skin, biggest organ, brain dudes, being overtaken by some weird rash, kidneys or gallbladder pumping out stones. You get the point, I hope. If you've got a brain, then you've got mental health to look after too. Bottom line. Just because the output is mainly social doesn't mean the disease disrupting your life isn't as important. Our brains are awesome, but also sometimes misguided in how to preserve our well-being. Tell someone. If they don't listen, tell the next person. But the best person to talk to is always a mental health professional. If you don't cinch with them, just move on to the next on. No biggie. Your whole body will thank you for it in the long run, my friends. Not a doctor, but I'm a trauma nurse. Motorcycles are fucking awesome, but they are also death machines. Don't ever get on a fucking motorcycle. But if you do anyway, wear a fucking helmet. Your body will tell us if you have done drugs, alcohol, or tobacco in the recent past. Please don't lie about it. We don't care about the usage as much as we need to know what route of care to prepare for with prescriptions and diagnosis. Obviously not a doctor, but I work in an emergency room. We aren't going to call the cops if you're on drugs. We need to know so we don't give you medication that when mixed with said drugs will kill you. Example, if you're high on heroin, a depressant, and you're flipping out, we can't give you Ativan or Benadryl cause it can literally stop your breathing and or heart. How to eat healthy. Just because you're skinny doesn't mean you're healthy. Especially the teenagers who I take care of. Sometimes I will ask them what's a healthy food your doctor wants you to eat. Rarely do I get a right answer. I feel like the internet has so many fad diets, and family members rarely cook, so families don't know basic nutrition facts. Not a doctor, but this information could save a life. In an emergency situation where you are giving first aid CPR to someone instead of stating general instructions to the group of inevitable onlookers like someone call 911, someone get a defibrillator point, if able otherwise some other form of direction, to someone and say you call 911 and you find a defibrillator. This prevents the bystander syndrome where people think someone else will probably do that and gives clear instructions, allowing for a more efficient process where literally seconds could mean life or death. It's okay to seek treatment for your mental health. Don't feel ashamed because you were diagnosed with an illness. Seeking help is a strength, not a weakness.